here and just look at what is under the plate. Just look.
What? What does that mean?
I don't know.
What does a single line mean?
There's 2 lines.
Wait, what did... Okay. What does it mean?
I don't know. I literally just took them.
What? Are you kidding me?
Hey guys, welcome back to my channel. As you can see from the title of this video, I am pregnant. I wanted to record a pregnancy series because I've seen them on YouTube before and they're lots of fun, and I just thought it'd be a really great way for me to look back on my pregnancy, and also because I think that there are I think there's some value out of my pregnancy that is worth sharing, because I didn't exactly get pregnant easily, and I've had kind of some health issues, and I thought sharing my story might inspire other women who are having some fertility issues, just to have faith that, you know, pregnancy is possible even if you've been told maybe differently. So basically in January of 2019, I went and saw my doctor because I just had a feeling that something was wrong. I've always kind of had irregular periods, but I just knew like something, like irregular periods isn't normal, and I just really felt like something wasn't right. And I mean, at that point I had been married for September, October, November, December, so it was like about 5 months since I got married, and I mean, it like, not everyone gets pregnant in 5 months. It's not like we were really like trying, but I had also been off birth control already for like 3 or 4 years, and so just I wanted to kind of go to the doctor and I guess see if my feelings about something feeling wrong was right, and it turns out I was right. So after doing lots of different blood tests and whatnot, I was sent for an ultrasound, and they found a bunch of cysts on my ovaries, and I was officially diagnosed with polycystic ovarian syndrome, or PCOS, which is actually super common, and I didn't know it was as common as it is until I was diagnosed with it myself, and I started doing more research on it. And there can be major health impacts in the future for people that are diagnosed with this, and it also can lead to fertility issues. So I was sent for more testing just to kind of see where my fertility was at. And so they sent me for blood testing for 3 months in a row. I had to get blood testing done each month 3 times for those 3 months. So like a total of 9 different blood tests in 3 months. And they told me I wasn't ovulating, like ever. It just wasn't happening. And they said that it was likely that I rarely ovulated throughout the year. Maybe I never did. They didn't exactly know. And there was a question of, well, is she not ovulating because she doesn't have any eggs, or is there another reason? So then they sent me for another ultrasound to see what my eggs were like. And so it turns out that I actually had lots of healthy eggs. Like, the eggs looked really great. There wasn't any concern there. And I also had a really healthy uterus. So the issue was just that my ovaries weren't really working properly and doing their thing, and they weren't releasing an egg. And I also had really low levels of progesterone. And so I was pretty upset, just because, you know, like when you're told your body's not doing what it's supposed to do, it's definitely frustrating. And then we kind of talked about some of my options, and my doctor prescribed me with a drug called letrozole, which is actually, it was first a drug prescribed for women with breast cancer, but they found that it actually made women ovulate. And so I did the first round of this medication, and again went for the blood testing to see if I ovulated, and I found out that the medication didn't work. I still didn't ovulate for that 4th month in a row. And my doctor came back and told me that we can increase the drug 2 more times. After that, they send you to an actual fertility clinic to seek out other options, which is when things start to get really expensive. So I clearly wasn't very happy that this drug wasn't working. And if anyone knows me, they know that I don't really like to take drugs. Like, I don't take Advil, I don't take Tylenol, I don't really take anything ever. And so I did do the 1 round, but after that, I decided that I was gonna try and seek an alternative route and see, you know, maybe if I just didn't really like think about things as much and I just lived a healthy lifestyle, maybe things would kind of correct itself on its own. And there was definitely some research to back that up. And so that was February, March, April that I had the first 3 rounds of blood testing done. And then in May, I did that fertility drug. And then for June, July, August, I just kind of did my own thing and I started researching different methods to kind of treat PCOS. And then on September 21st, 2020, I found out I was pregnant. And so finding out I was pregnant was like a huge shock to me because I actually didn't get a period in June, July, or August. I took a pregnancy test at the beginning of August, just before I knew I was having like a weekend of drinking, and it was negative. So to find out September 21st, 2020 that I was pregnant was crazy to me. I didn't have any pregnancy symptoms. Today is like October 4th or 5th or something like that. And let me tell you, I definitely have pregnancy symptoms now. Lots of nausea, lots. I haven't thrown up yet, luckily, but like the nausea is like debilitating. Like I'm just a couch potato sometimes. Haven't worked out at all. I definitely have like food aversions. I'm really craving Sour Patch Kids, but I know that's not healthy for the baby, so I actually haven't had any. Boobs, oh my god, I have like okay, I've always had like the tiniest boobs, and they're like twice the size that I've ever like had them in my whole life, and so I'm just hoping those continue to get massive because that would be nice for me for a change for once. Yeah, so okay, yeah, today is the 4th, it's a Sunday, and I have my first ultrasound on October 6th, and that will tell me officially how far along I am. Okay, so I had my ultrasound and it went pretty good. I was told that I am 6 weeks and 4 days along. They can be very accurate, I guess, because they just go by the size of the baby, which is like 7 millimeters right now. So I'm actually not as far along as what my doctor predicted based off of the HCG levels in my official blood test that I got done. The only weird thing is, so they didn't give me like an official due date because I guess according to AHS, you have to be 7 weeks along for them to actually like consider you pregnant. I did get to see my little baby though, and that was like the most heartwarming moment, actually, like seeing the baby and hearing and seeing the heartbeat. It was just like a little flicker, like a little thing moving, and that was pretty cool to see. And I don't know, it just made things feel like a lot more real. I have it on my fridge, actually. I got 4 pictures. I'll show you guys that. So the baby's like crazy tiny. It looks like a little peanut. And I mean, it's just like a blob. But yeah, that's the little guy, little girl, I don't know.